So in terms of treatment for women who become pregnant or plan to get pregnant, who have opioid use disorders, the biggest risk, the concern really would be active drug use, overdose while pregnant, or sort of withdrawal, severe withdrawal, even if it's in a detoxification program. And for that reason, the gold standard treatment for women who are pregnant for years now has been methadone, because methadone has the best results in terms of retention in treatment, reducing recreational drug use. At the same time, we've had buprenorphine for the last 14 years or so, and more studies are coming out that suggest that women who are taking buprenorphine during pregnancy actually have better outcomes. And there have been some large studies that have shown that the risk for neonatal abstinence syndrome is attenuated for fetuses or babies that are born to women who are on buprenorphine rather than methadone. So at the end of the day, either treatment that's working for a woman is what you'd want to continue, largely to prevent the possibility of relapse, overdose, withdrawal, because that's what could lead to fetal distress. And there are much lesser concerns about the potential impact of methadone or buprenorphine on the developing fetus or newborn infant. The real risk is overdose and death while pregnant.
So there are some risks, but it sounds like the risk of not staying on a MAT medication when a woman is pregnant, it far exceeds the risk of them going off the medication.
It does. If you look at patients with opioid use disorders, the annualized mortality rate is about 1% to 2% a year, which is really concerning. If you look at the age-adjusted rate of mortality for a 20, 30-year-old woman, the risk of death is 6 to 20-fold higher if the woman has an opioid use disorder. So that's of great concern anytime, but especially for a pregnant woman. Methadone, buprenorphine help save lives. They help save pregnant women's lives. They help prevent relapse, help prevent overdose. At the same time, obviously, if there's a fetus that's exposed to methadone daily, when the infant is born, the infant will have some physical discontinuation symptoms from the methadone. It would also have discontinuation symptoms, which is called neonatal abstinence syndrome, in response to going off of buprenorphine. But an infant can't be addicted. There's no loss of control, drug cravings. It's not interfering with daily life for the infant, but there are some physical symptoms that can sometimes lead to hospitalization. The infant can benefit from having morphine administered, but we know that patients receive much lower doses of morphine, have less distress, and stay in the hospital for much shorter periods when they're born to women who have been maintained on buprenorphine rather than methadone. The most important thing is to be in effective treatment.
Great, thanks so much.